Okay, so causes-wise, PTSD is a little unique compared to other psych disorders in that it requires some sort of physical cause, some sort of experience of trauma. However, there are definitely some underlying biological predispositions that can also make you more susceptible to PTSD. So things, for instance, like a smaller hippocampal volume. We talked about how the hippocampus is kind of the memory center, right? So memory formation, retrieval, storage, that type of thing. So a smaller volume might kind of lead to abnormalities of this memory formation or really reliving and drawing back those memories again, that type of thing. Also, just having lower benzodiazepine levels in your frontal cortex. Benzodiazepines reduce anxiety. So we talked about that on the anxiety slide. Also, produces relaxation. So if you have lower levels of that, it might lead people to be more on edge, more anxious, often leads to individuals with PTSD to self-medicate with alcohol to try to feel relaxed. So this is kind of helps explain why it might not occur in every person who experiences traumatic events. So it only occurs in about 10 to 30% of war veterans, probably those individuals who are more have a predisposition for PTSD. But also learning plays a huge role. So classical conditioning again. In essence, you've kind of conditioned yourself to some sort of stimulus from that traumatic event. And likely you've generalized that fear, that conditioning, to other related things. So even if you learned an association, for instance, in war, that a particular loud sound meant a bomb was nearby, maybe now you've generalized that. So any sort of loud sound will cause you to feel that same fear. Environmental, though, of course, the dramatic event has to happen for PTSD to work. And I want to reiterate again that it doesn't have to just be war. It's the most commonly kind of talked about version of PTSD. But for instance, like one of my best friends from back home experienced PTSD from a soccer accident. She broke her leg playing soccer, and that caused her severe flashbacks and kind of detachment as well. So it can be any sort of traumatic event, but also in combination with that, low social support. So you're more likely to be diagnosed with PTSD after a traumatic event um, if you've got low social support in the 6 months around that event. So you don't have individuals who are able to kind of relate to you and help you get out of it. And so that can kind of cause you to detach. Treatment wise, so medication sometimes helps. Those selective serotonin reuptake inhibitors, SSRIs, or antidepressants in general, are sometimes used to try to treat those feelings of depression. Um, Psychologically, it's typically treated with cognitive behavioral therapy, CBT, to try to, restructure those cognitive distortions and promote positive constructive behaviors instead. However, one thing to note is that since PTSD will often result in substance abuse to try to um, relax those thoughts, you got to address those substance use disorders as well that often result from PTSD. So there's kind of um, a combination approach to treating it.